All right, we're going to go and get started. So thanks for joining us if you're here on our first live Q&A. This is Dr. Schwertz. I'm Haley, I'm the office manager. So we are going to discuss what is dry eye today and also how we evaluate it here in office. We have a couple of questions that came through in our messenger that we will touch base on for those patients that messaged us, and we're going to get started. So we're going to start with Dr. Schwartz. What is dry eye?
So first off, I just want to say how excited I am to kick off the Q&A for this month. As you guys may or may not be aware, July is Dry Eye Awareness Month, and we're just so stoked to be able to connect with our patients, our audience, our Facebook community, to just, give you guys more of a glimpse as to what we see every day, the questions that we hear every day, and to hopefully answer some of the questions that you guys may or may not, be wondering about. So, a common question we get in our office a lot is, what is dry eye disease? Well, it's a really, really broad term for a condition where your eyes are not lubricating the surface of the ocular surface in an adequate way. So it does this in a couple ways. Either you're not producing enough of your own tears, or your tears are constantly evaporating in a very unhealthy manner. Some people have one versus the other. A lot of our patients tend to have both because the two both coincide with each other. But a lot of patients are going to experience symptoms that they may not even realize are dry eye symptoms, such as your eyes being red, eyes that water a lot, your vision going in and out and getting very blurry, a lot of patients with light sensitivity, and your eyes getting really tired towards the end of the day. So
yeah, I think that's a very common thing that we hear from patients when they come here is, I don't have dry eye, my eyes water all the time. Well, what you're not realizing is they shouldn't water all the time, but that is, even though it sounds contradicting, that is a sign of dry eye. Eyes can be overly watering and still be dry, and that's because they're not retaining on the surface like they should. So that was actually one of the things we were going to touch base on is watery eyes are dry eyes. So misconception there from a lot of people. I think you kind of touched base on symptoms to look for when you were saying that, right? So itchy. A lot of people like to say it feels like grit or sand in their eyes when they blink, so that is the surface of your eye being super dry. And when it comes to that, you can also develop ulcers in the eye, right, from them being too dry.
Absolutely. So when your tear film is severely dry, meaning you have very little to non-existent tears that you're producing, or your eyes are not lubricating adequately by having very insufficient oils in your tear film, then the other structures of your eye become at risk for a lot of conditions like corneal ulcers, high risk for infections, high risk for styes, red eyes. Being basically, when you don't have a healthy tear film, you are a walking magnet for eye infections. So red eyes, pink eye, things like that. So a lot of patients don't realize that if they get these issues chronically, that they may have an underlying condition where their eyes are just really dry.
Yep, perfect. So one of the questions that we got was, what causes dry eye, and is it hereditary? Because a lot of people have family members who have had dry eye. So is dry eye hereditary, and what actually causes dry eye?
That is a really good question, because we do have patients that ask, my mom had really severe dry, am I at risk for it? I've seen them go through multiple doctor visits, and patients come in being very concerned that they're at risk for it as well. I would say that there is definitely a little bit of a hereditary link, especially if you've had family members, your mom or your dad have any underlying, especially the autoimmune conditions, if they have had conditions like Sjogren's, or if they have had rheumatoid arthritis, diverticulitis being a common GI condition. Those conditions have predisposing hereditary factors. Also, some more common conditions like hypertension, diabetes, those may not be directly linked to dry eye disease, but they cause risk factors that can put you, at higher risk for developing dry eyes. So we do have a lot of our diabetic patients who need to be educated that they will develop some of these symptoms as their condition goes on, and that's something that we need to look for as well. So is it hereditary? It can be with strong family risk factors. And then the second question that you asked, how do we develop dry eyes? Well, a lot of it can come from our family history, but it is so multifactorial and very complex, and that's what makes our jobs very interesting and always a challenge with our patients every single day, because it can come from so many factors. You may work in a very dusty environment, which would cause environmental triggers. We live in the South where a lot of allergies are present, and you may have allergy that could be an underlying trigger. So many of our patients are heavy computer users, and not just at work, but at school. And so the computer digital device use is going to be a high risk factor that we see very, very common in our practice. So those are some of the big ones that we see in terms of what causes it. And we always try to get down to the root cause in terms of what are the triggers that you have at work and home, and some of your lifestyle things that you're doing too, to see if we can modify that.
So to follow that question, the other one we had was, how do we prevent dry eyes? What can we do in our everyday lives to help prevent developing dry eyes?
That's a really good question. Being proactive and reducing the risk for developing dry eyes is huge, especially now that it's becoming a bigger and bigger epidemic, as the years go on. If you're a parent and you have children who, are on their screens, try to be a little bit more proactive in reducing some of that screen time. I know it's not realistic to have no screen time, but, really modifying and trying to control some of that that screen time to reduce risk factors. The American Academy of Pediatrics really does recommend somewhere between 2-3 hours per day on screen time if it's not really just for schoolwork alone. You can eat a diet that's really good in essential, omega fatty acids. So the foods that lean more towards Mediterranean type foods, like your hummus, your spinach, your dark green leafy vegetables, are good for other conditions of your eye, but also give you the nutrients that you need. You really want to just supplement. Salmon's a great thing. Just having a diet that really leans that way will help give you some preventative measures. And just being proactive and seeing your optometrist to make sure your eyes are healthy, and being ahead of managing your eye health. It's also good to know. So it's also good to do.
Perfect.
Yeah.
So I think we kind of touched base with this earlier when we were talking about symptoms to look for and things, with the whole, if your surface is too dry or you're feeling that gritty kind of sensation, you can develop, ulcers on the eye. So following that, what happens if I don't treat dry eye? What happens if I just ignore the problem, let it keep going? Obviously my meibomian glands are very important for producing tears. So if we're not taking the proper steps to help our glands, can they die off? Can they, are they repairable? Just touching base on, what happens if I don't treat them?
Yes, yeah, that is, a lot of patients do ask that, what's the worst that can happen? And I think having detrimental changes to your vision, a lot of patients have really reduced vision that can lead to, sometimes in worst cases, blindness, but rarely. But you can have really terrible vision if you're not being proactive in managing your eye health. So the biggest thing that severe dry eye causes is just a really terrible reduced quality of life. And that's what we hear day in and day out from our most severe patients, is that just getting in the car, driving to the grocery store, visiting their family, spending time with their grandchildren. These are things that are highly affected when they're just trying to enjoy, spending time with their family and going to work and feeling that they have, that they can spend their day without having to think about their eyes. So it's just really important to be proactive on that end. One of the things that Haley touched on is our structures in our eyes that produce the meibum. They're called meibomian glands, and meibomian glands are the structures that produce the oil, which is the very front surface of our tear film. Over 85% of patients who have dry eye disease have some sort of form of meibomian gland dysfunction, which we call MGD. And if you have MGD, this is a way you really need to go to the eye doctor first to get this diagnosed. But if you are diagnosed with meibomian gland dysfunction, it's really important to take early intervention and to really follow through with some of the steps that your eye doctor, or we can help recommend some things. Doing frequent blinking exercises, I call them eye crunches, where you simply just squeeze your eyes at the computer every 30 seconds, maybe 30 minutes to an hour. It's just those little small actions go a long way. Using heat, on your eyes, if you have a mild form of it, is also a way that you can help be proactive in managing that. And if you have a more severe form of it, we have so many treatments in office that are extremely effective in managing this condition.
Sorry, I was laughing because I realized I look like a deer in the headlights. My brain went to something that you had said, and I got off into like thinking about the question, and I realized that I was like wide-eyed. So while you were talking, you had said something about vision loss. You know, and so that is something that I work in the optical shop as well, so I do glasses. And that is something that I commonly hear from patients when they pick up their glasses, is that their vision is not great. Like they feel like it's fluctuating throughout the day. So you may wake up and you're seeing fine out of first thing in the morning, or maybe you wake up and you're not seeing fine, but throughout the day you see better. It just fluctuates back and forth. So that is a sign that, the eyes are drying out throughout the day, because typically if I give these patients a drop to put in their eye, all of a sudden their vision is back to being fine. So when your eyes are drying out, your vision is not working properly either, which is why also when we start, like we have patients who come in for complete eye exams, and while they're here, we're evaluating their dry eyes too, and we see that they have severely dry eyes. So before we finalize a prescription, we want the patient to know, like, this, you could see fine out of this, you may not see fine out of this. Like, we want to make sure that we're offering the treatments to you so that we can get the best visual, acuity for you that we can. And a lot of the times, if that is the case and they do proceed forward with treatments, we hold off on finalizing a prescription or doing glasses until after the treatment, because you can refract, and refraction is where we do the test, which is better 1 or 2. But you can refract totally different after all of your treatments than you did at the beginning, because your eyes are now properly lubricated and functioning correctly. And so that's something I wanted to bring up, because it struck me while you were talking, but that's something we see in office all the time. And I don't think patients realize that dry eye can affect them to that extent, so I wanted to bring that part up. So now let's go into how we evaluate the dry eyes. So when they come in, what all testing we do to figure out where their source of dry eye is coming from in order to recommend the right treatments for them.
So when a patient visits our office, the first thing they're going to fill out is a dry eye questionnaire. It's called the Ocular Surface Disease Index. We call it the OSDI for short. And this questionnaire is to help us garner to what level symptoms you have, whether it's mild, moderate, or severe. It just helps us understand and get a gauge of where you're feeling. Once you have that filled out, our technician is going to take you to the back of our clinic, and we're going to run a series of tests. One of those tests is a scale by which we evaluate how quickly your tears evaporate. And then the other test is actually taking an infrared image of the meibomian gland structures, and we call that meibography. And we usually lower the lower lids and evaluate the structure of those glands and see, to what level severity you have with those structures. Once you have those 2 scans taken care of, then we're going to do a test that's going to test how much tear production you have. And this test is called a Schirmer test. And what we do is we put a numbing drop in your eye, and we stick devices in your eyes that measure this tear production over 5 minutes. And this actually measures the level of natural tear production that you make. So we numb your eyes first, put this strip in, and again, measuring the natural tears. And I stress that because a lot of our patients have reflex tearing that can occur, and we really want to get an idea of what's being produced on a natural basis. So once we get all of this information, we can understand if you have problems with tear production, which is called aqueous deficient dry eye, or if you have problems with producing your own oils, which is meibomian gland dysfunction. And based on the information we get, our doctors can then tailor a treatment plan that's appropriate for you.
And I just zoned out again. So that's the biggest flaw. I wish I didn't. But touching back on the meibomian glands, just to kind of explain those, we always tell patients to think of those as little rivers that flow from the bottom up to the top of the surface. So ideally, when we do the scans that she was talking about to test the glands and to see what they're looking like, they should look like perfect little rivers that flow all the way up, deep, pretty white lines that go all the way to the top. When they are not functioning properly or when they're clogged, they look like puffy little clouds. So instead of a dark, fine white line that slivers up to the top, you have this puffiness that shows that there's blockage and it's not able to bring the tears all the way to the surface. So it's always fun for us, and I think for the patients too, to see those before and after pictures. So we take a picture of those glands, bottom mainly, but top as well, and looking at those from the point of, you know, your first eval to when we're done with the treatments. It's always such a satisfying, like,
It is.
yeah, it's just nice because you can see that we have, you know, unclogged those, they're flowing properly to the surface and they're working great. So I always enjoy seeing those before and afters, and I think the patients do too. So we evaluate, we treat. Is there a permanent fix or cure to dry eye?
Unfortunately, there is not a permanent fix or treatment solution to dry eyes. When you have some of these risk factors that you're born with, either genetically or you are in a work environment that's probably not going to change for the unforeseeable future, or just some things that you're just more predisposed to, you know, when you are diagnosed with dry eye disease, it is something that you have to manage and control, you know, for the duration of your life. And the earlier that you're more proactive in managing this condition, the easier that it will be, you know, moving forward. If you take the steps to do the things that your doctor recommends for you early on in the early intervention, it may be that it may be years before you have to do any kind of in-office procedures to reverse and treat that or get it to a much better place. For our practice, we see a lot of our patients who are already at the moderate to severe staging, and so at this point, what we're trying to do is really restore your dry eye to a place where things are much more manageable, comfortable for you on a day-to-day basis, and just improve your quality of life and allow you to enjoy the things that you want to enjoy every single day. So these treatments that we do, we oftentimes recommend a series of treatments up front to really try to get to the bulk of the issue that you're dealing with. And then for a lot of our patients, maintenance treatments are necessary. And that is a very case-by-case dependent type of thing. So we really tailor those recommendations on maintenance treatments based on, you know, on an individual basis.
Yeah. So just like, well, like you said, everybody's going to be different, and that's just like with sickness. You know, I could get sick with something, and she could get sick with the same thing, and my symptoms may be worse than her symptoms. So everybody's going to be different as to how quickly their body reverts back to what it was. And so some people could go 6 months with no problems, and you know, we like you to follow up every 3 months to kind of reevaluate and make sure that everything still looks good, that we don't need to do any maintenance treatments. And like she said, we have patients who can go a whole year without needing anything. It looks great. But then we have those who come back after 3-month follow-up, and we do need to do a maintenance treatment. And it's important to do those every 3 months, because if we let it get too far out of hand, you're back to square one and we're having to do damage control. So there's other things too that we offer after treatments to continue, you know, being able to see those results and keeping your eyes healthy. And one of those being our electric dry eye mask. The big thing about the electric mask versus the microwavable mask is having that consistent temperature on the eyes for an extended period of time. So you get the mask out of the microwave, you put it on the eyes, but after 2 minutes it's already cooling off and you're not retaining that temperature. So the big thing is setting a temperature on that mask, setting a timer on that mask, and keeping it on the eyes for that extended period of time with that same temperature being there the entire, you know, time that you're wearing it. And that is something we absolutely recommend after every treatment to make sure that you are keeping your glands, you know, warmed up or whatever, you know, continuing to keep them flowing. You know the word I'm looking for.
Keeping the oils flowing.
Keeping them from hardening and clogging back up. Now, is that going to keep it from happening altogether? No, but it is certainly going to help with the longevity of it and to take most of the damage out of not doing it, I guess.
Maintenance, I cannot stress maintenance enough after these treatments, because the better you are with doing your part at home, usually what happens is the longer you're going to get out of these treatments. You're going to be able to extend the life of these treatments a little bit longer. And it's just good to get in these habits, because if you're not doing anything on your own at home with your lifestyle or just maintenance things, your symptoms and all your signs can revert back, and that's challenging. You know, when you feel that you've made some progress and then you take a few steps backwards. So you know, managing your dry eye disease is definitely something you've got to be really, you know, hands-on with. So,
Sure.
yeah.
Well, I think that is all that we have got.
Okay.
Anything else you think that we need to touch base on that we didn't touch base on? Trying to think.
Yeah. I think we've covered quite a few things. Just
We
an
did.
introductory, like a Q&A.
Yeah. I mean, we didn't expect this to last the full hour. We knew it was going to be pretty short, but you know, we're excited to try this new thing and interact, and we hope that, you know, y'all enjoy the video and get some information out of it that's helpful. As always, you know, you can call our office and ask questions if you have any that we did not touch base on, or if you have questions about what you heard today and you want to get more information, feel free to call our office. Our staff is more than willing to help and get you to the right person if they don't know the answer to it. We will be on next week, and Dr. Schwertz will be here as well, and we're going to be discussing the treatments that we offer. So we'll probably touch base a little bit on some of these things because they'll tie in together, but for the most part, that discussion is going to be on all the different treatments we offer and, you know, why we choose to do certain treatments on certain patients and all that jazz. So if you have any questions in regards to that you want to hear answered, you can message us or comment on the post that I'll make after this about next week's video. So we thank all of you for joining us that jumped on, and hopefully we'll leave this up on our wall after we turn it off. So if you have any questions, you can comment on the video and we'll be happy to answer them from there.
All right. Sounds great.
I think our first one went good.
Good.
Bye, everybody.
Bye.